once.
I think we can start with the introductions and all of that.
Yeah, by then I suppose.
Then he should be.
Yeah, because this is an unusual time. Usually we have it 6 hours later, so people are not used to it. That's why I've put it in the WhatsApp that we're having it at 12:30 Indian time.
1 minute.
Derek, hold on.
No, I'm not admitting him.
Yeah.
All right, let's
we have 19 people waiting.
Yeah, that's okay. That's all right. They'll join.
They'll all join, I suppose, in due course.
Eskahel is in, okay.
Alvin has come, yeah.
He's come, okay. Then I think Dr. Ravi will join soon.
Yeah.
People have to decide between lunch and webinar.
For you, yes. From
You're in India.
For us, it's
I don't want to keep anybody away from lunch.
I had an early lunch, so I finished my lunch at 10 o'clock in the morning.
Good day, Alvin.
Hi.
Hi, Alvin. Now, please stay straight.
Hi, Alvin.
Professor Alvin, don't keep giving us, we are getting vertigo looking at your screen. Don't keep rotating. Just stay in one place.
Yes.
See, don't do that. Don't do that.
Yeah. Today, in fact, my daughter is getting married.
Oh
and
my
so
gosh.
I have to, you know,
Congratulations.
this is a hotel.
What did you do to this?
Congratulations.
Congrats.
This is a hotel room. But then, all right, so I guess the meeting
Father of the bride.
Yeah, the meeting will end at 5, but I might have to leave a little bit earlier.
That's all
Oh
right.
no, you're excused. You're totally excused.
Yeah, I have to welcome my son-in-law.
Yeah, it's important. Yes.
I have to learn to be a father-in-law, you know.
Very good.
Steve, that's Alvin Chan. He's from Hong Kong. He's from the Hong Kong Medical Association and also the treasurer of the Confederation of Medical Associations of Asia and Oceania. So he represents Asia and China.
What
Very
we'll
nice
do,
to meet you.
Professor Alvin, what we'll do is after Professor Stephen's talk, maybe we'll give you a chance first so that we won't, I think he's already distracted. No hope today.
Okay, I don't know what's happened to Ravi.
Okay, let's start. Let's start.
So I'll admit everyone and then we can.
Yeah.
Hello.
Professor Russell, we can start the session.
Yes. Good morning, good afternoon, good evening, and good night. Good evening to all our participants from around the world.
Hi.
A very big welcome to the 30th webinar of the UNESCO chair in bioethics, the series hosted by the Department of Education. As you all will know, this is, I know for some of you, this is, we usually have it a little later, but today is a very special webinar that we're going to have. And so we've had some changes taking place in terms of the time, but also what we're going to be discussing today. I want first to acknowledge all our presenter and our very distinguished panel of discussants. Our presenter, Professor Stephen Vogel, is sitting up from California, University of California, Berkeley. It's after 11 in the night, almost to midnight, to present this important analysis that he has put together. We also have our distinguished panelists from around the world, but I particularly want to acknowledge our colleagues from United States, Florida, it's 2 o'clock in the morning for them, and from Canada in Ontario, where it's also 2 o'clock. So thank you all for joining us today from around the world. It is very important and interesting, and I'll come to introduce each of our panelists. Today, we are moving into a rather a new or a different territory. I must say, this series has gone, we have covered a range of areas beyond just health, into education, into schools, into students, universities, and so forth. And today, we've also had economists, but today is a little different because we have with us Professor Stephen Vogel, who is the chair of political economy, and he's the professor of political science, and also he has a chair in Asian studies, and it's at the very prestigious University of California, UCLA, University of California, Berkeley. We did have our colleagues from University of California, San Diego, and we also had from Los Angeles. I'm really delighted that we now have the Berkeley, University of California, Berkeley. So, Professor Stephen, I'm delighted to welcome you here. And today, Stephen has been doing a lot of work and presenting and teaching in this area. And he's put together his analysis of health from different countries and looked at performance indicators, economy, governments, and these are key, including health. And these have been taken from leading countries and will offer possible hypotheses explaining these national variations in policy responses to the pandemic that all of us, the world over, is transcending, traversing, and together we are working on this for the last almost a year. So that's going to be very interesting. I've had a preview of some of the data, and I must say it's fascinating because we've never seen all together being put in, so we had a chance to compare this. Now, on the other side, we have a very distinguished panel of who are going to be discussing this, and they come from different areas of health and law. So we have with us Professor Vivian Harpwood. She is a professor of health law at Cardiff University. And importantly, she is also the chair of the NHS, one of the NHS trusts in Wales. And she plays an important role in healthcare planning and delivering of services and so forth, while also being an expert in health law. And she's part of the education department of the UNESCO chair. Now, welcome, Vivian. I know it's 7 or 6:30 or 7 when you joined us from United Kingdom. We then have Professor Dr. Ravi Venkadekar, who is a surgeon, but very importantly, he is the treasurer of the World Medical Association and has been the past president of the Indian Medical Association, which is the largest medical association in the world, but now represents the WMA. So welcome, Professor Ravi, for joining us. And he's been actively working with this whole pandemic in not only India, but the whole of South Asia. So welcome to you. And then I'm so delighted to welcome and introduce to you Professor Joseph Thornton. Professor Joseph Thornton is from the University of Florida, and it's 2 o'clock in the morning, and he's joined us. He's a very important part of our Department of Education. He heads the unit at the university, and he's a professor of psychological medicine, and also very much involved with the health service in the veteran affairs and so forth. So he's joining us. Welcome, Joe, to this webinar. And then I'm going to I'm delighted now to introduce to you Professor Alvin Chan. And Professor Alvin Chan is a pediatrician, but he is from Hong Kong, and he is the current treasurer of the Confederation of Medical Associations of Asia and Oceania, which is one part of the world, one region of the World Medical Association that covers Asia and Australia, New Zealand. So, and I'm delighted that Alvin Chan has joined us from his daughter's wedding while he's at the wedding. He's joining us with that. So congratulations to you and your daughter and
thank you
family, right? And
yeah, thank you, Russell.
To this, yes. And we have with us now, very importantly, Professor Sharif Aminullah, who is also part of the Department of Education. Professor Sharif joins us from Ontario, London, Ontario in Canada. So now we have on the top of the world, and I'm joining you from Melbourne, which is down under. So we have both sides of this, the globe coming together at 2 o'clock in the morning. And Shabib is a professor and the head of geriatrics and so forth. But I'm delighted to welcome you. We also have another person who should be joining us, and it's Professor Walter Jaco, who is a professor at the University of Nairobi in East Africa. And so we come together with the world, as it were, or at least parts of the world that will be looking at this information and taking this to look. And what we're going to do, it's the international panel will discuss these indicators and the hypothesis that is being offered, and we will try to apply these to understand what the world has learned from the pandemic experience, and this will be useful and helpful in how we think, decide, and act in future pandemics. So that's what we are going to present to you today. Now, it's my great pleasure to welcome my co-chair and the moderator, Professor Mary Matthew, and then we have Professor Derek D'Souza, who's also the moderator for the participants. So can I hand you over to Professor Mary to welcome and to give your words?
Thank you, Dr. Russell, and welcome to all our panelists and our speaker for today, also Dr. Professor Stephen Vogel, and to all our participants. Thank you for joining us. It's an unusual time for certain countries. We know that, and especially India, it is lunchtime. So thank you to all who are sacrificing their lunch to attend this webinar. And today we have a very exciting session, which I think as health professionals and citizens of the globe, it's important for us to know what exactly is happening around the world regarding COVID-19, a different perspective, not only in terms of health, but in terms of economy. So before we start, to all our participants who are joining us, please do take active part in this discussion. You may place your questions in the chat box, and Dr. Derek will take the questions and address it. I request the panelists also, if you wish to answer the questions of the participants in the chat box, you may do so directly and even share links if possible. And I also like to welcome Professor Kami, who's been here, who's with us, or who's joining us today. And as usual, Dr. Derek, would you like to give any house rules before we start?
Yes, Professor Mary, thank you and welcome to everyone. I think most of us here are familiar. So other than the panelists, can I request everyone to keep your videos off and your microphones on mute so that improves the quality of the telecast. And like I said, we can keep the chat box active, and even our panelists can answer some of the questions which are posted there, because it takes time to have everybody speaking, and we can utilize the chat box to allow a parallel conversation to go on there. So thank you, everyone, and back to you, Dr. Mary.
Can I once just introduce, yes, Mary, thank you for welcoming. I just want to introduce Professor Amnon Kami. I should have said that in the beginning. Professor Amnon Kami is the head and chairholder of the UNESCO Chair in Bioethics, and is probably the patron to all of us. He's been the support to all of us here, and we are very grateful that it's early morning, I think, for you also, Professor Amnon Kami, and thank you for joining in this important webinar today. Thank you. And I also welcome Professor Geeta Lakshmi, our Vice Chancellor of of the university, but also an active member of the Department of Education and the Asia Pacific Division. And Des Cahill, thank you. Welcome, Des Cahill. Professor Des Cahill is from RMIT Melbourne. He's from the Melbourne unit of the UNESCO Chair, and he is a professor at RMIT. He has been diligently giving a summary every webinar. 30 summaries are there, executive summaries, which are on the website, alongside with the recording of each of these webinars. So thank you and welcome to all of you.
Thank you, Professor Russell. And may I request Professor Stephen to start his presentation?
And Stephen, you can share, I've made you co-host so you can share your screen with your presentation.
I will do that momentarily. Thank you for that excessively gracious introduction, Russell. And I am really deeply honored to be joining such an esteemed group. I think I have to be honest with you right off the start to say that I am not an expert in public health. So I expect that I will be learning a lot more from you than you will be learning from me. But I do have a few slides to share, so I will attempt to do that now.
If I remember answer, then we can go straight to the rainbow room and
Okay, hopefully that worked.
We can see,
So
we can
this-
see yes, screen.
Yes, okay, great, fantastic. So I am not an expert.
Sorry, Steve, can you?
You've
can you
muted
answer?
yourself, Professor Steve. You have muted yourself.
Okay, good.
So I'm not quite sure how I managed to mute myself, but I guess I did. So I am not an expert in public health, but I am supposed to know something about political economy. So I will come from that vantage point. There's a couple of problems with our topic today. One, of course, I mentioned already, which is that this is not really my area of expertise. A second, which we are all acutely aware of, is that this is a story, we're right in the middle of it. So there is not really any outcome to explain, because if I say that a country has performed relatively well, that could be proven wrong in a matter of weeks or months. But in any case, what maybe I can do is give you a sense of how a political economist would look at this problem. These are just the outcomes that we all know about as of November 19th, so a few days ago. And as you know, the United States leads the world in the number of cases and deaths, but there's been a recent resurgence in many countries, especially in Europe. So these are just some of the sample countries in terms of the number of deaths and cases. But as you can see, there's really a dramatic variation between if you look at, for example, the United States at the top and then South Korea at the bottom. South Korea, of course, a country, as you recall, that had a very scary beginning, but a very strong response. Some people have suggested that these numbers here are actually underestimate the actual number of deaths and cases. I am not a statistician, so I can't give you a definitive answer on that. But if, for example, we take the United States case and we look at the number of deaths compared to an average year, the difference is even greater than the number that you see in the normal statistics. So if anything, these numbers are undercounting rather than overcounting. In any case, that's kind of one simple outcome one could look at. What is the number of cases and what is the number of deaths? But if we wanted to give kind of a fuller picture, we could imagine a kind of a wider range of performance indicators. Again, this is really much closer to your areas of expertise than mine. But you could look at some of the proximate causes, the immediate things that would affect, right, the health outcomes, like the ability to detect transmission chains, to minimize hospital-acquired COVID-19. Fiscal support is really more about the economics side, but then if we go down to the second from the bottom, protection and support for vulnerable and neglected populations, that actually relates to both the health outcomes and the economic outcomes. So I guess all I'm trying to do with this slide is to say that we could, right, in an ideal world, go beyond the simple outcome of number of cases or number of deaths to look at a broader array of areas in which countries are either performing well or not so well. Now I'm switching to economic outcomes. I'm going to be kind of switching back and forth in this presentation. This is the economic decline in the second quarter. And you can see, for example, that the economic contraction was much more severe in the United Kingdom, which is at the bottom, than South Korea, which is at the top. This is looking at unemployment. And so if you look at the one I just showed you, you see that the United States contraction was not that bad, only minus 9.5%. But if you look in terms of employment, the United States was really the worst, right? In the sense of going in terms of a dramatic increase. So that red to blue, in other words, unemployment in the United States boomed from 3.7% to 10.4% in a very short period of time. Then it's maybe a little bit silly to put the health outcomes and the economic outcomes together, but that's what this graph does. And it shows so that the higher the dot is, that means the worse the health outcomes are. And the further to the left, that means the worse the contraction of the economy. So if you wanted to kind of make a simple line from best to worst, it would go from South Korea having the best outcomes both in terms of health and economy, and the United Kingdom having the worst in both. This is kind of a fun little diagram. At Oxford, at the Blavatnik School of Public Policy, they have a project where they have created various indicators of COVID responses. And so they created an index that rates the stringency of COVID restrictions. And so this stringency index includes, as this says it at the top, school closures, workplace closures, travel bans, etc. And so what it does is it shows the top countries. And once I get this moving, you'll see the countries will start to appear, starting from January, and moving. Let me see if I can, here we go. Oh yeah, here it goes. So you can see it's not moving very well, but South Korea was the most stringent at the beginning. So that's a hint in terms of its success. And if you move on across time, you'll see that the United States started very low in February and through March, and then became much more stringent. So I guess what this tells you, and I will share the slides later, but in any case, what it tells you is that that the US was not so much that it was less stringent, but that it was slow, it was late, right? And South Korea was early. So part of the story is moving quickly versus moving slowly. All right, so I think that's enough of that one, sorry. These are the scale of the, then we're going back to the economy. The scale of the economic stimulus packages, which were large in most countries, right? So these countries spent a lot of money to try to prop up their economies. And those three different columns, the one on the right is tax relief. And you can see, for example, that's relatively high in the United States. The next one in the middle is government spending. That's also quite high in the United States. And the one to the farthest left includes everything. So that's tax plus spending plus loans. So that number on the left column is so much bigger because a lot of the stimulus came in the form of loans. Now, many of those loans are ultimately going to be forgiven, but that's part of the stimulus package in most of these countries. So at least in the short run, most of these countries responded quite vigorously to try to support the economy, to support businesses, and to support workers. Now, another thing that makes this whole enterprise complicated is, of course, that everything is connected, right? So if we start at the end of the story, at the health and economic outcomes, lots of different factors are involved. Obviously, so cultural factors, weather, the nature of the leadership, various specific events, right? So it's very hard. I actually started trying to create a kind of a causal diagram, and I realized it was so complicated that I gave up. So instead, what you have is a causal chain in this slide. And this is, I'm not saying this is the actual causal chain. I'm just saying these are some of the pieces of the story, right? And I guess one thing I'm trying to show in this slide is that my area of political economy kind of is in the A to B area, right? And maybe the public health experts would be more on the D, E, F area. So anyway, we kind of have to put all those stories together in order to understand this phenomenon. But in any case, if we were to take this as a causal chain and just kind of pretend for a minute, we could say that you have politics, right? So democracy or authoritarian government or the certain nature of the government, that might affect, so that was A, that might affect B, which are policies, which it might mean include the healthcare system, the labor relations system, the financial system. And by that, I mean the policies before the pandemic even showed up, right? And then C would be the policies after the pandemic, the specific responses. And I guess what I'm suggesting is that C doesn't come out of nowhere, right? So it's affected by A, politics, and by B, pre-pandemic policies. And then D is how those policies are implemented, because you can have great policies, but if they're not implemented effectively, they won't have the intended effect. E, of course, is society, right? Because you could, for example, you could have a mask mandate, but if nobody pays any attention to it, it will not be effective. So I guess what I'm saying is that it's very hard for a political science or a political economy theory to give us a direct line to either the health outcomes or the economic outcomes. At the very best, it's one piece of a complicated causal chain. So all of that is by way of apology, and then I'm going to go ahead and throw out some hypotheses anyway, just to make this interesting. So the question would be, what explains the variation in national experiences with the pandemic? And as I suggested, these are initial hypotheses. We couldn't possibly do any better than that because, as I mentioned before, we don't actually have the final outcome. All we know of is the outcome as of this day in November 2020. And very few studies have been done in the sense of done to completion. So most of the hypotheses that I'm going to kind of outline today briefly come from very short pieces, newspaper opinion pieces. I will try to tell you who the authors are of these, but I'm not trying to pretend that these are completed research projects. These are kind of initial ideas coming from lots of hopefully relatively smart people. Okay, so Lenhart and Leatherby, these are New York Times journalists, but they're basing their hypotheses or their ideas, at least in part, on some work by some very accomplished political scientists, specifically Stephen Levitsky and Daniel Ziblatt, who wrote a book that got a lot of attention in the United States called How Democracies Die. But anyway, their hypothesis or their idea is that those countries with radical right, illiberal populist leaders fared worse with this pandemic because they discounted scientific expertise. And so the cases of that, the examples would be of those kind of populist leaders would be US, UK, Brazil, and Russia. The positive cases, right, with leaders that really pay attention to scientific experience, expertise and value expertise would be Germany, New Zealand, and Taiwan. And these New York Times columnists note that those countries also happen to have female leaders. So the countries with female leaders seem to do better than those with men. So that's just one hypothesis. As you can see, I'm just going to throw out lots of ideas and then we can talk about them. So the next one is, this is a political scientist, but he's writing in the Washington Post, and he's actually done some research on this. So he knows something about what he's talking about. And so his idea is that countries with proportional representation electoral systems do better. So proportional representation electoral system is the electoral system that is common, particularly, let's say, in most of the world, but certainly like continental Europe, where you typically vote for a party, and then the legislature reflects the proportion of the vote that each party got, right? The other fairly common electoral system is what's called the first past the post system, which is what we use in the US or UK, where you have a single member district and whoever wins the most votes wins that seat. And so what Selway is trying to tell us is that countries that have proportional representation have to have a greater ability to forge compromises and have more inclusive coalitions, right? Because a US or UK type political system is more winner take all. The conservatives win and they take over, or Labor wins and they take over. Same with Republicans and Democrats in the US. So anyway, that's his thought, right? And the positive cases, which are all countries that have proportional representation, would be countries like Germany, right? South Korea, New Zealand, Taiwan, Hong Kong, Israel. Again, the negative cases, these are cases with first past the post electoral systems, US, UK, France. Okay, this is a very different idea. And this is also a column in The Economist, but once again, the columnist is building on some academic research. There's some academic researchers named Hall and Soskis who wrote a book called The Varieties of Capitalism. And basically, they contrast what they call coordinated market economies. An example of that would be Germany. And liberal market economies, examples of that would be the US and the UK. And the main difference between those two types is in the name, which is that coordinated market economies have a better ability to coordinate because the firms have a pattern and a capacity to coordinate with other firms, to work well with their own workers, to work with the banking system, et cetera. And compared to a liberal market economy, which is kind of more competitive. But the interesting thing in Hall and Soskis, and also in this article, is Hall and Soskis don't say Germany's better, and they don't say the US and UK are better. What they say is that Germany is good at some things, and the UK are good at some things. And specifically what they say is that Germany is good at incremental improvements in manufacturing. And so that's why they're so good in the auto sector or in machine tools. But liberal market economies like the US and UK are better at like breakthrough innovation. So that's why they excel in areas like biotechnology or aerospace. And so the Economist columnist is applying that to the pandemic and saying, okay, what we would expect is that Germany would be better at responding in a policy sense. But the columnist is trying to remind us, but the breakthrough innovations, right, in the vaccines and the treatments are going to come out of the US and the UK. And we're starting to see whether that's true. It does look like the US and UK are doing well in the race for a vaccine, but we know other countries like China and Russia and many other countries are making progress as well. So that's going to be an interesting competition. Weber and Gilman. Weber is one of my colleagues here at the University of California, Berkeley. And his argument is that political regime does not really matter. In other words, that you can be a democracy and you can do well or you can do badly. You can be a more authoritarian or less democratic political system and you can do well or badly. What does matter is operational experience, long-term planning, and the socialization of risks. In other words, the ability of that country to spread risks, right? And that determines which countries have been most successful. And as evidence, they point to 3 different patterns, which with the A pattern being, the best, B being second best, and C being worst, right? So the A pattern is Singapore and Taiwan. These are countries that took preemptive action and they really didn't have a full-fledged outbreak. The pattern B are countries that had terrible initial outbreaks, but that then were controlled by a very strong response. That would be China and Korea. And then the third pattern would be delay and fragmented response. and that would be Italy or Iran or the US. So again, this is kind of interesting because Weber is a political scientist, but he's saying it's not really so much politics as government capacity that really matters in the case of something like a pandemic. So this is Jeffrey Sachs, the very eminent economist, and he wrote in a column that countries with higher inequality fare worse. And the logic is that according to him, is that countries that have higher inequality have lower social cohesion, also lower social trust, and more political polarization. So the mechanism is both political, in that these countries are more divided politically, and it's also in terms of social response, societal response, right? You have higher levels, lower levels of social trust, and so less compliance, with orders about public health issues. So he just has negative cases. These are countries all that had high inequality and all that have struggled in their response to the pandemic: the US, Brazil, and Mexico. Jim O'Neill, this is a former investment banker, but he was involved in creating an index, which is a growth environment score. And so the interesting thing here is that the growth environment score has nothing to do with the pandemic. And yet he found a very high correlation that the countries with a higher score on the environment score did better in terms of dealing with the pandemic. So his argument is not that there has any direct relationship, because he doesn't think there is, but he thinks that the metrics that he included, or he and his team included in that index, included things like health system quality, or things that affect health, like technology adoption or levels of inequality. So the inequality part agrees with Sachs, but the countries with higher scores on his index have better technology adoption, and they have fared better. So for him, the positive cases are Singapore, Hong Kong, South Korea, Germany, China. The negative cases, this is starting to sound familiar: US, UK, France, Italy, Brazil, Russia, India. Kopczynski and Gonsalves. Kopczynski is a law professor at Yale, and Gonsalves, I believe, is actually a public health expert also at Yale. So they've worked on the US healthcare system. And you'll note the date there, it's March 2020. So they wrote this article before anything had really happened. So it was more of a prediction than an explanation, but their prediction was pretty good, which is that the US was going to be a negative case. And it was going to be a negative case because it has a very fragmented healthcare system. It's one of the few, or the only rich democracy that doesn't have some form of universal healthcare. And that is a problem in a pandemic because you have gaps in access, and so you would predict that the US would struggle in a case like this, and that turns out they were right. Okay, now I'm switching over to the economic side for a couple of ideas. This one is an economist article, but also one that's built on research. In fact, this economist article is looking at US versus Germany, but a very eminent French economist, Jean Pisani-Ferry, has done a similar study, or actually a more rigorous study, looking at the US versus France and finding the same thing. The furlough model is one in which the government pays for paid leave, so that businesses that have to shut down during a lockdown can maintain their employment. So it's basically a model designed to protect employment. And that contrasts to the US model, where there's not really the same attempt to preserve jobs, but instead it's an unemployment insurance model that says, okay, you're going to lose your job, but we will pay unemployment insurance to keep the worker afloat. And what both the academics and these columnists are arguing is that the French or German model is infinitely superior to the US one because you preserve employment at a lower cost. So it's a win-win solution. So basically it's arguing that the furlough model is better than the unemployment insurance model. This is Elsa Mosok, who is a PhD student of mine, who is now a postdoctoral fellow. I invited her to join us this evening or this morning, depending on your viewpoint, or this afternoon, but unfortunately she couldn't make it. She is a French national who is living in Germany, so she knows these two cases very well. This is also on the economic side, but she came up with a fascinating finding, which is in terms of bailing out the small businesses. She found that France actually did a better job than Germany. That may sound unusual because Germany does a lot of things better than France, but not this, right? And the reason is quite simple, especially if you know the French and German financial systems, which is that there's a much tighter relationship between the French government and the French banks than between the German government and the German banks. And what she argues is that that tight relationship between the government and the banks actually paid off for the French because you got a much more cooperative solution. Just to give you an example of what I'm talking about, basically, there was a shared understanding. So the French government said, please help us out to get these loans out to French small businesses. The banks played along. But when the German government tried to do the same thing, the bank said, what's in it for us? How much are you going to pay us? Right? If this doesn't make money, we don't want to do it. Right? So that's you know, in a crisis, that's kind of an important difference. Okay, so now we're getting towards the end, but what I wanted so I've actually got two research papers. Like I said, most of the ones I've been talking about so far are newspaper columns, maybe that are based on some academic research. These are two studies that actually did correlations, right? Who did a statistical analysis. I'm not necessarily saying that's better or worse, but it's just a different approach. Obviously, when you're doing a statistical analysis, you have to look at a fairly specific outcome. So they're just correlating with levels of mortality. So anyway, the first one found, it took a whole bunch of different variables and it tried to figure out which ones correlated with higher or lower mortality in a particular country. So what they found is that government capacity, interpersonal and institutional trust correlate with lower mortality. Not surprising, but still interesting, right? On the negative side, again, this isn't going to be surprising either. Bureaucratic corruption and ethnic fragmentation correlated with higher mortality, right? But they also found that populist government and female-led government did not correlate either direction. So the findings from this study contradict a couple of the findings of the earlier columns that I mentioned. So this particular article comes to the following conclusion. This is how they try to kind of sum up their data. They say state capacity is more important than government accountability. In other words, it doesn't matter whether you're a democracy or not. It doesn't matter whether you love your political parties or not. But the administrative or bureaucratic capacity of the state is critical in a crisis. Here's another study, which was also using statistical correlations, but grouping countries into groups, right, by the type of political economic system. And so what this particular study found is that the state capitalist countries, China, Korea, and Malaysia, had lower mortality rates. The liberal market economies, US, UK, Canada, had higher mortality rates. So this matches some of the earlier findings I mentioned. And so then other groups of countries are in between. The in-between groups include the mixed market economies, France, Italy, and Spain, and also the BRICS, Brazil, Russia, India, and China. So as you can guess, it's basically impossible to take all of these studies and sum them up or come to any, or to offer you any conclusion. as I admitted at the beginning, these are just hypotheses. The outcome is changing on a daily basis, and the causal chain is quite complex. But if I had to kind of throw out a few initial ideas about how one might, add up these different findings, it seems like the political system matters, but not by itself, only in combination with other factors such as individual leadership. And I guess I should also admit at this point that there's lots of things I've left out, in the interest of time and also given my limited expertise. But, and you all may have much more to say about that, but for example, one could say that those countries that have had pandemics, such as Ebola in Africa and SARS in Asia, countries that have had some experience with this seem to fare better. So that's obviously another factor. I do think that you have to add in individual leadership, because even though I've talked about all of the kind of structural weaknesses of the United States, we also have to be honest and say, if the United States had moved even a week or two earlier than it did, we would have had a different outcome, even in the same country. Second, policy expertise and execution seem to be more important than political regime type. In other words, we can't come to a general conclusion that democracies handle this better or authoritarian countries. That doesn't seem to lean clearly either way. But countries where the leadership respects expertise, scientific expertise, seem to do better, and those that have the administrative capacity to execute their policies. Finally, in terms of political economy features, and this goes back to my point about that causal chain, that we as political economists, we're not really that good at explaining an outcome like a health outcome. So we just have to be honest and clear, I guess, about what we can and can't do. But there are some things that that political economy, I think, can explain. For example, the link between the healthcare system and healthcare access. That may not be too surprising. Or the link between the pre-existing labor relation system and the ability to preserve employment. Or the link between the nature of the financial system and the ability of the country to keep businesses afloat. Those are things that political economy can help us to understand. But if we want to go all the way to the end of the line and look at other, for instance, public health outcomes, we need to bring in many other variables. On that note, I thank you for your patience, and I'm really looking forward to hearing what the discussants have to say.
Thank you, Professor Stephen, for a very interesting exposition on what's happening right now regarding COVID-19 and its effects on economies and political leadership and the healthcare system. Professor,
Maybe I should stop sharing so we can see each other.
Yes,
I'm going to
please.
stop.
Yeah, thank you.
Yeah, yes. Thank you.
Thank you very much. One thing from what I've seen is there are three things which are important here when it comes to talking about this pandemic and its effect. One is the political system, the second is the healthcare system, and the third is the people per se. So that is very, we may have a good political system, we may have a good healthcare system, but the people may not respond to what is good for the country. So that is also a very important point. I will bring Professor Alban. Would you like to go first? Because I do want to relieve, take the load off you, because yeah. Professor Alban is coming. I have asked to unmute Professor Alban. We will let you go because you have your daughter's marriage to attend. So thank you for coming in. And Professor Alban is from Hong Kong. So Professor, what is your take on it? Because Hong Kong, like Professor Stevens said, had the experience of SARS.
Yes.
So they learned they kind of acted very quick, very fast.
Yes.
And what has this done to the economy of Hong Kong? What has it done, to the people per se in terms of employment, and what maybe a little bit about the political leadership?
Yes, at that time, in 2003, we had the SARS, and then at that time, within 3 months, about 1,800 citizens were infected, and then out of that 300, almost 299 had died. And so at that time, we had a very tragic and very a sad memory of it.
Yeah.
So that's why in 2020, many people in Hong Kong are still fresh in the memory of that. And so when the experts had said that a new SARS had come, we better all gear up. So the medical team as well as the lay public all responded well. And however, this time is different from SARS. SARS at that time, very few people, in fact, knew that it was such a deadly virus at that time. And so we were so unprepared. This time, yes, we were more prepared, but the medical experts had divided opinions from the beginning. So when WHO in February said that, oh, we don't need to put on masks, and social distancing might not be that important. And well, in Hong Kong, some of our experts had also, perhaps at that time, had such views as well. But very quickly, then some of the specialists had already switched their opinions that to the point that, well, masking is very important. And the social distancing is very important. And so from February onward, so we could say that those who had the view of universal masking had already won the battle. And we have to disregard the views of WHO and all those Western experts, So I think the same thing had happened in Singapore, as well as in Taiwan and then mainland China as well. So in our community, the people then listen to the experts in our community, and the expert very soon became united in the views, in the scientific views to give to the public. And so it's easier for us to implement those regulations. And however, of course, if sometimes this policy of masking or social distancing might not be really that effective enough, because political implementation of the government for all stakeholders will have to take into consideration of economy, take into consideration of diplomatic politeness and respect and honoring, etc. So that's why there were exemptions of testing and quarantine at the border control. And that is, I would think, is a fatal, one of the most unfortunate thing in Hong Kong. That's why we had the third wave in June and then onward. Now, the first wave and the second wave were that the first wave was in January and February, and that was because our border immediately in contact with mainland China. Of course, the Chinese cases would come to Hong Kong, and then we could be affected. But at that time, because of our stringent control, well, it seemed that we have very few mortalities, and the infection rates in the society was minimal. Even in the second wave, that is the massive inflow of students coming back from Europe and UK. You know, the students in UK have a massive exodus back from UK and Canada or Australia to come back to Hong Kong in April and May, because at that time, UK began to have serious infection already. And then, well, the students, parents all urged their students, children to come back to Hong Kong, return to Hong Kong. So the massive influx brought back a lot of students. They might be positive or confirmed even on arrival. But then even up to June, we only had just a few hundred of cases confirmed. And then just about 8 died, 8 had died only in the whole community. But the unfortunate thing is the government in June had listened to some VIP to give exemption to some sailors and crew of those transport industry, to give them exemption so that they could change their duties in Hong Kong. And then they could arrive in Hong Kong, enter Hong Kong, exempting testing and quarantine. And that is so bad. And the taxi drivers brought these sailors and crew members infected with a mutated species. I mean, the D614G. That is, initially it should be a D614, and then they mutated to a 614G genome. And this mutated virus entered Hong Kong. And from that time on, starting from early July, and we had an explosive rise in the infected cases in Hong Kong, and then the mortality. So it is coincidental that because of the Father's Day in the mid-June, you see, the government want to please the citizens. The government yielded to the plea of the, entertainment industry, yielded to the plea of the restaurant and the catering industry, hotel businesses, etc. So they opened up a lot of those regulations. They loosened the rules, and then people were allowed to move much more and dine more socially outdoors. And then that's the coincidental influx of those mutated virus from the Filipino sailors, etc. Now, we don't blame those Filipino sailors. We blamed the government. It's the government who had the exemptions for testing and quarantines at the border for these groups of high-risk carriers. So that brought the virus into Hong Kong. So within 1 month, we have thousands of, infected confirmed cases, and then up to 100 patients died. So we are so sad. Well, fortunately, within 3 months, that is in September and October, the condition was well controlled again, with only single digit of confirmed cases every day, or even sometimes 0 cases of local community cases, only just a few imported cases through the border. But again, the same story repeated at the end of September. We found, in retrospect, we found that some patients were in fact again carried viruses into Hong Kong because of exemptions of testing and quarantine. And we found that what we have been asking the government to stop those exemptions, to minimize those exemptions, were futile. The government still had those exemptions at the border. Yeah, and that's so bad. Again, at one carrier, I mean, in one single flight, there have been 17 Nepali passengers found to be positive in this virus. And yet they had all entered Hong Kong through taxi drivers carrying them into Hong Kong. And only just last week, we found that, oh, this is again a new strain of the COVID-19, again mutated, carried through these infected passengers coming into Hong Kong, exempted from testing because they were, diplomatic workers, senior workers in the consul generals, and even some passengers from mainland China also got exempted from testing, and yet they had been found positive 20 days after they coming into Hong Kong. Now, of course, this could be a conundrum whether those Chinese passengers brought the virus from mainland China or they got infected in Hong Kong, because there's 20 days left. But 14 days as incubation period is only a statistical one. That is, most people would have an incubation period within 14 days. But it doesn't mean that it's just 14 days. In some scientific studies, they have found that some incubation period could be as long as 40 days or 30 days. Of course, they are exceptional, but they do occur. So we are asking the government, first of all, to really tighten the border control to minimize the exemptions, even though there should be diplomatic politeness. We still have to check the, they could be quarantined, they could be exempted from quarantine, but they should not be exempted from testing. Yeah, and also there should be designated destinations for these people coming from highly endemic areas. So they should be carried by designated buses, special buses from the airports to the designated consul generals, their houses, their residence. Well, if they are allowed to go home, all right, because they were special VIPs, we could allow the exemptions for quarantine, but still they should be tested at the border so that within 1 or 2 days they could be found positive, and then they could be isolated. And even if they stayed in their own residences in the consul general, it's still dangerous for the people staying with them. So that's what we are asking. And also for these people tested positive or from those highly endemic areas like USA, for example, that we hope that, the specialists in Hong Kong are trying to convince the government that after the 14 days of quarantine, we still require them to have 7 more days of observation. That is to be safer. And then the last thing is we had already well planned the travel bubble with Singapore. We joined hand in hand that we trust each other, and so citizens from both places could travel reciprocally without the mandatory testing and quarantine on arrival. But just on the eve of inauguration of this plan, Hong Kong had a massive rise of confirmed cases again just 2 days ago, So that is our 4th wave. So this beginning 4th wave halted our well-planned travel bubble. And so it's deferred for 2 weeks to reconsider. So how unfortunate, just because of the loopholes of the policies and the implementation of the government. They said they listened to the specialists, but they just listened in words, but with no deeds, no action. So sad. So it's not as simple as the theories proposed by those economists presented by Professor Steve, they listened partly. They just listened superficially. But when they implemented, they had to consider all stakeholders' interests. They had to consider all the factors, and then they compromised. And after compromise, their expert opinion is not expert anymore.
Yeah, that's true.
Thank you.
Thank you, Professor Alvin. Thank you so much for coming in and giving your views. We're sorry that we're taking you away from the ceremonies of your daughter's wedding. Thank you very much.
The ceremony will start 45 minutes later, so I have to get prepared.
You're still here with us. Thank you very much.
Yeah, thank you. I enjoyed so much listening to Professor Steve's talk. Thank you very much. And thank you very much for giving me this opportunity to participate in this webinar. Thank you. Thank you, Professor Mary and Professor Russell.
Thank you.
Thank you.
Alvin,
what you said makes sense that, and I think from Stephen's perspective, the economists and political economists on one side are trying to put it together, but you're bringing in a practical policy that could make all these different. What do you think about it, Stephen? When you look at
that's the real world. I think most political economists, maybe not economists, but political economists, we are very cognizant that the world is much more complicated than any particular model could possibly capture. So I certainly appreciate Professor Chan's perspective. And like I said, these are just general trends that you can say, for example, that if you have a more capable government or a more effective implementation, or if you have greater respect for expertise, on average, all of those things are going to lead to a better response. But average is not always average. Things happen. So that's why I was suggesting, right, that if the United States had moved a week earlier, you'd have a different outcome. And that in the same country, you could have had that with a different leader. So so there's a lot of variables.
Yeah, that's right, Professor Stephen. My observation also is that there was also this issue of WHO giving out advisories to various countries, and whether the countries were following it or not, they were also giving conflicting views. Like Professor Alvin said, initially they said masking was not required, but because of their experience with SARS, they knew that, they need the physical distancing and masking, which is important to contain this virus. So that was the problem too, that advice that was being given was also conflicting. Another thing is that anytime, and this is really an observation, anytime we have let our guards down is when we get another wave. And whether it is politically or due to sheer exhaustion of this continuous lockdown and quarantine, whatever it is, and even on a personal, as people, when we let our guard down is when we are prone most for because this creates a lot of fatigue in terms of mentally and emotionally. So we see these waves not only because of political reasons, but also because we are also not careful. That is very important. Now, I would like
Mary, can I just introduce, I came in a little later, so I didn't have the chance. And one of our other very distinguished panelists is Professor Rajiv Tandon. He joined us. He is from the chair at the University of Western Michigan from Kalamazoo. And I thank you, Rajiv, for joining us at this part of the day or morning or night, as it were. Thank you for joining in this important webinar, which we are trying to come to some understanding of where this all will meet. And as Stephen just told us, we are in the middle of the game, so we don't know what the outcome is going to be. And I think Rajiv has a great interest, and he's also involved in the work in Michigan State and so
Yeah.
forth. So thank you for joining us
Thank you.
there.
Thank you. May I request the participants also, if you wish to ask questions to the panelists, to please put, or to Professor Steve, please place it in the chat box and we'll address it. I'd like to go to Professor Ravi.
Bye-bye.
Bye. Thank
Bye-bye,
you.
Alvin. Bye-bye.
Yeah, Professor Ravi, can you hear us? Can you unmute yourself? Yeah. Professor Ravi, what Professor Stephen has said, the experience in different countries. When you look at India, practically everything that he said can be applied to India in different ways, because India being the variations in what has happened, the outcomes in, because of this pandemic has been different in different states in India. Certain states in India are doing very well, and some of the theories, Professor Stephen, that you mentioned can be applied to certain states in India. And some of the aspects where you said, they're not doing well can be applied to other states in India. So we have seen all the variations that you mentioned in, because at the
In
end
your
of
own country, yes.
Yes, in one country, we have seen the variation because it depends on the state and the policies that, how each state views the pandemic. Professor Ravi, would you like to say something on this?
Yeah, thank you, Professor Mary. You have made my job easy by your initial comment. And I entirely agree that with our vast socio-economic political variations and the second largest population, whatever very rightly described by Professor Stephen, can be applied, and we have experienced it up till now, that the response of the various provincial governments, considering the individual leaders of those governments, their social and economic inequalities, their literacy standards, their civic sense, their participation from the community, all have affected the outcomes of this disease. And it was really, I should thank your entire team and Professor Stephen for giving us technical persons. We as doctors, today we got a different insight from a political scientist or a political economist, considering this pandemic. And I entirely agree with Professor Stephen that still we are in midst of this crisis. And even though these are hypotheses, by and large, if you will see that, you will find that these hypotheses in last 6 months we are seeing that they are holding quite true. There was one small contradiction, that wherever there are female leadership, and in the second thing it was that they don't matter. But I think another aspect which Professor Stephen would definitely look into it, that both the German leadership and the New Zealand leadership both are having scientific backgrounds. So maybe female leadership, more than that, it is their scientific background which has helped them to understand and to heed to the scientific advice more. Coming to the Indian scenario, the second aspect was that we have a very low per million case rate and further lower mortality rate. Now this, various theories are put forth for it, which probably are outside the purview of today's discussion, but definitely those factors also have to be considered in for a country like India, where maybe it was the BCG vaccination, universal BCG vaccination, or poor hygienic conditions. There was a very interesting study where the poor hygienic conditions, which led to lower mortalities.
Yeah.
But again, the third point about Indian response was that I totally agree that it is not the form of government, but the capacity of governance. Unfortunately, the health infrastructure in our country to manage such a pandemic was never ready. That is why we had to force a severe lockdown, which was quite long. And this severe lockdown, though it gave us the time period to enhance our capacity, but it also caused severe economic hardships. And so these both things are to be balanced against each other. Secondly, even though our first case in India was discovered in the last week of January, we enforced the lockdown much later on. Again,
March.
probably
March
it was
18th.
said that because the President Trump had a very huge meeting in India in the last week of February. And during that period, lot of international travel was allowed. And only there, 1 month after that, only lockdown was instituted. So nearly probably, as Professor Stephen has said, that if we would have instituted lockdown a month prior, maybe the Indian scenario would have been a bit different. And we are hoping that fortunately, even after a very biggest festival of Diwali, now eight days have exactly passed after the Diwali. Though we are seeing some surge, but it is not the same surge which we are observing in the Western countries or in the continental Europe, UK or USA. Our second surge is much lesser than not only number of cases, but in the indicator of mortality also. So that also needs to be seen, and we have opened up lot of economic activity. So this hypothesis also has to be studied. Another month into post-Diwali we would be in a better position to actually find out whether what is helping us, that our second surge is much less than the first surge, our mortality is much less, the hospitalizations are by and large less. Our oxygen requirements have gone down, our ICU bed requirements have gone down in spite a mild second surge. So I think our own, as very rightly said, that each country and within the country, we have very different responses. So all this thing would be definitely needs to be studied extensively for future reference of, because this wave of pandemics will keep on coming because it is again linked to the climate change. Thank you, Professor Mary.
Thank you, Dr. Ravi. That's what I think time will tell why we have seen such a difference in and variation within a country and across the globe. But I hope we can take some, learning points after this pandemic is finally over, that we may not repeat our mistakes again. That is what is very important. Professor Rajiv, would you like to, you had said that you couldn't unmute and you wanted to make a point.
Thank you. Dr. Vogel, thank you. Interesting insights, and important perspective. Let me ask you a couple of questions, focusing back specifically to your hypothesis, to your proposition, and the many important points that you made. But before I, pose those two questions to you specifically, we'll all agree, as serious scientists, that we believe there is a difference between fact and opinion. And that's an important difference. We all agree that perspectives and where we are coming from matter and influence how we interpret data. And we all agree that we have ideas, hypotheses about what might explain what is happening. There are data that we need to examine rigorously, and we need to rigorously interpret them. So these are some general points of agreement, if you will. So the question is this. The two observations with question are these. One, from a scientific perspective, what I was impressed by in your presentation is also, I've read some of your articles and a couple of books that you've written on market craft and things of that sort. So I'll come to that from the perspective of bias, if you will, or point of view, where you're coming from. But from a scientific perspective, what I was impressed by in your presentation is that you picked and chose, to illustrate different points. One was country with good response versus country with bad response to make a certain point. And for example, you contrasted France and Germany. And we'd all agree that by and large, the response in Germany in the management of this crisis has been better than that of France, as shown by a number of outcome measures. And yet you pointed out, to illustrate a particular point of view, you showed where France was doing better things of that sort. Scientifically then, I think what might be more useful, if we really want to kind of make sense of the information we have, the data that we have, is let's put a table together and let's, before we actually even examine the reasons for difference, let's decide what a good response and bad response country looks like. Knowing that this is arbitrary, knowing that there is nothing black and white about it, but we want to understand the data. And once you have a good and bad response, let's look at the 20 or 30 or 40 different characteristics in which we compare the good and bad response country. Let's not pick and choose which scientifically that would be the right thing to do, right? I mean, because I can make any point I want to make if I pick and choose what kind of data and how I present it to you. So so that would be I didn't see that in your presentation. I've seen that in a couple of articles from some other collaborators of yours, but I think that would be a useful thing to make it even more rigorous, because as you point out, there are multiple determinants of anything happening, and there are multiple factors, and you highlighted many of those. From a scientific perspective then, a multiple regression way of analyzing data would be more informative, knowing that it might be a difficult thing to do, but statistically, if you want to draw conclusions from and really make the best sense you can of data, knowing that there are multiple determinants, A, a table, good versus bad response, and B, then essentially controlling for the many different variables that interact, as you rightly pointed out, do a multiple regression analysis. I've not seen that done. So from a scientific perspective, I think there is a lot more to learn from the data. And one of the things I don't think we should do, and we'd be making a mistake if we do, is if we have preconceived conclusions and then we pick and choose the data that we choose to draw upon. Not that our conclusions are wrong in any way or inaccurate in any way. However, we want to make the best sense we can of the data. So that's the scientific question to you. I mean, would you not agree that that would be a more rigorous and more effective way of making sense of the data we have? The perspective point of view is this. Correct me if I'm wrong, but you're not a huge fan of Milton Friedman and what you have called the shareholder capitalism and the so-called American view or practice of the free market economy. You're more in you believe more in market craft. You believe that government action is very important, and I don't think anyone would disagree that government action is critical in terms of effectively responding to any situation and addressing the needs of the people. But but you're not a fan of Milton Friedman. You're more on the lines of, say, Amartya Sen. And I use these examples because I know there are a number of colleagues from India who would like to know that you're actually more on the lines of Amartya Sen and Abhijit Banerjee, who believe more in a certain view of the role of governments, if you will. So the question there for you is, you spoke about state capitalism and you spoke about the great response from China, for example. And one of the things that I've often wondered about is government separate from the people? I mean, isn't government of the people? I mean, isn't whether it's a democracy or a dictator, whatever it is, the difference between a democracy, and there are different kinds of democracy, as you pointed out, but essentially, a dictatorship in which you, the people below, and I, the dictator above, who knows what the right thing is, and state capitalism, the way it is and the political structure in China, which is, you know, the party decides. And yeah, of course, you're all members of the party, but the party leadership and Xi Jinping is, you know, and his cohort, it's not even an oligarchy. It's even more concentrated than an oligarchy, if you will. I mean, how do you factor that in your thinking about the propositions you've made?
That's a lot of thinking, Professor Stephen, for you.
I will try to respond succinctly. To do those questions justice would take a very long time. So for the first part of your question, I think I will just leave that as a very astute comment. I will agree with you that we would have, you know, to make a scientific analysis, we would have to agree on our criteria for assessing the outcome. I guess the only comment I would add to that is with something as complex as the pandemic, it's very difficult to boil it down to one outcome because there's so many different facets. So I agree with the ambition, although I think it might be hard to do. I really appreciate your comments on MarketCraft, which, you know, is closer to my actual research, where I try to take on to challenge the Milton Friedman view that there is such a thing, not only that there should be a free market, but I try to question whether there even is such a thing as a free market, in the sense that every market is governed, and that we have to start from that beginning point. And I think it actually does connect to the pandemic, because there's nothing like this pandemic to kind of prove the point that there are certain functions that the government absolutely has to play, that the market cannot solve certain problems. And so I think that highlights the importance of government. To attempt to address your last question, which was a fabulous one about China. I mean, I'm trying in the book to emphasize that there is always a need for government, both in the sense of dealing with crises, but also in the more kind of mundane, everyday sense that the government is actually what which makes markets function properly. And so that's a role that cannot be abdicated. But my book was just translated into Chinese, and so I got some pushback along the lines of the same kind of comment that you're giving me, which is that this argument in the wrong hands could make a Chinese dictator very happy, you know, because it might justify an all-powerful government. So I'm certainly not trying to do that. You know, that governments can be too powerful, both politically and economically. In a sense, that argument is more one that's pushing against free market ideology of the Milton Friedman sort in the United States, and it's less targeted at you know, kind of the overbearing state capitalism of China, which I certainly would not endorse.
Thank you, Professor Stephen. Thank you. I'll give Professor Shabir to respond to Professor Shabir. I hope you're awake. Sorry, it's early in the morning.
No, that's absolutely fine.
Yeah.
Thank you, Professor Vogel. It really was interesting. I'm not really an economist, but I have a fascination for economy because, like psychiatry, it's nebulous and very hard to fathom. I do take exception to a few things, though, in the data. Journalism is one of those professions that has lost its credibility in the last 10 to 15 years. And we often reference them as points or yardsticks by which we measure certain things. You know, this notion of a developed country versus a developing country has been turned on its head. The nation that we thought could actually cope with the pandemic no longer has shown not just the ability or the scientific prowess, but the assumption that somehow the bureaucracy is to be blamed, not the political party, is not really correct. Political interference at all levels has been fairly robust, and it still continues to date in non-health related areas as well, which we would expect no interference in. The second thing is the articles you reference do not remotely reference a right-wing populist government in a huge democracy, which is quite glaring. The third thing is the notion that we have economies that have what we call gig economies, like in Canada. The gig economies have actually kept people alive. Many a times when we've had these things going on where we dismiss them, we're not able to support people who have little more than probably delivering milk to your doors, and there is no other accountability for what they do. So in India, when we had the migrant crisis, there was a massive number of people who actually suffered, and we don't take into account human suffering. Statistics and economists rarely look into the suffering of individuals, which I think is a huge fallacy. The last point I will make, and because I know everybody has been very patient in listening to us, and it's been a very interesting talk, is when you can print money to support an economy, is that a liberal economy versus state capitalism, which we abhor? Thank you.
So those are some great points, and I'm just going to have to confess, I'm not sure I can do justice to all of those questions and comments. So I'll just take a few. So in terms of printing money, I think that the conventional wisdom has evolved quite a bit on that, and many countries are finding that an expansionary monetary policy is much less problematic than they thought it would be. But in terms of whether that's characteristic of a liberal market economy or coordinated market economy, it's actually, I think, and maybe this is the gist of your question, that's a different dimension. It's an important one, but it's not one that's captured by those typologies. I am a political scientist by training, so I'm going to avoid being thrown in with the economists. But I guess actually some of your comments tied, I think, back to the previous comment about Milton Friedman and also about Amartya Sen, who is one of my heroes, and I assign regularly to both my undergraduates and my graduate students. But the way I teach political economy of development, I don't know if you would approve or not, but we start with theories. This is when I'm teaching it. We start with theories of development that really focus on, that basically assume that you want growth, that you want, that you want more money, right? That it's not it's not based on actual human experience. But then I kind of take a turn, and that's where I bring in Amartya Sen and other thinkers like E.F. Schumacher, or Marilyn Waring, who does feminist economics in New Zealand. But anyway, to kind of critique the basic presumptions of that. So I think maybe to do justice to your comment would take much longer, but I will say that I share your sentiment and your suspicion of kind of narrowly economistic views of development. So thank you.
Professor Stephen, what about Professor Shabi's question on the media, whether the sources are really reliable? Because you had quoted the newspaper articles.
So these newspaper articles are not newspaper articles by the newspapers. These are commentaries by either columnists or by academics. So and the truth is that because this is a moving target and it's only a matter of months old, there are no books out. There's not even that many refereed articles. I mentioned a couple at the end. So I'm openly admitting that a lot of this is speculation, but it's speculation by some fairly reputable people. And the articles that are in the newspapers, I think in each case, I tried to mention the academic research that it was linked to, right? So it might be an article in The Economist, but it's an article in The Economist that's talking about a research that was done by a certain scholar. So in that sense, it has a little more credibility. But ultimately, these are hypotheses. So it's up to us as the consumers of the hypotheses to decide whether they have any merit or not. And I'm throwing them out for discussion. I'm not endorsing one as the truth, because I don't think we know.
Thing is,
think,
Professor Stephen, do you think that the newspapers have political leanings too?
Oh,
That's
some of them,
something-
absolutely. Yes,
Yeah.
absolutely.
So do you think that, when we are, quoting them, whether it's actually, just like the media also has political leanings.
Oh, absolutely. But if Jeffrey Sachs is writing an article in Project Syndicate, then that's Jeffrey Sachs, right? Or if The Economist is quoting Holland Soskis, that's Holland Soskis. So in some ways, that's you know what you're dealing with, right? Okay. I mean, they're opinion pieces, so they reflect the opinions of the columnists, and in many cases, they're telling you their source, right? That they're quoting a particular scholar. That doesn't mean you agree with them, but in some ways, I think it's actually more honest than, for example, the news media that pretends it's telling you news, but really is giving you opinion. What I'm talking about really are opinion pieces. So we know their opinions, right? Their opinions based on some research, but then ultimately it's up to us to evaluate that.
Yes, that's true. That's totally, absolutely true. Professor Joe, would you like to give your comments? And then probably we can take Vivian. I hope Vivian is there because I can't see her video. Okay, you're there. Okay, so probably you can speak after Professor Joe. Is that okay?
Okay.
Yeah.
Yes, I'll try to be very brief. I listened to it. Our sessions has with the notion that ethics is a verb, and so I wonder, what does this mean to me? What should I do? What can I do? And so, with the various hypotheses of the outcome, I'm looking for the one that may be most actionable, particularly by us as individuals and professionals. One of the key points is that in our profession of healthcare and science, it's to provide good data and good interpretations of the data, sort of like Dr. Tandon mentioned. And so when we look at the excess mortality, which is, I think, an incredibly important consideration in how we look at outcomes, one of the other interpretations of the excess mortality, which has divided our country so much, is that it's not undercounted COVID deaths, but it's deaths that resulted from the COVID response. So the lack of access to healthcare, the burden of unemployment, the burden of substance abuse, domestic violence. We don't have good numbers on that. And so as scientists, it's our responsibility to try to find those numbers and provide them for decision making. When we talk about credibility of journalists, I think the credibility of science has really been a tragedy in this. And my personal opinion about our politics the past 4 years particularly is that all our institutions have been decimated from the diplomacy, international trade, the economy. We don't know who to believe or what. When I was in university, we used to have a big set of knowledge, and each of us tried to master what we could of that set of knowledge and compare our interpretation of the data. These days, it looks like we're all playing in different ballparks trying to get together. And so again, the onus is on us to try to maybe narrow and try to get some data. So what I take from this is I need to get to my own house and get some better data to present to people who can interpret it and put it together in their analysis.
Thank you, Professor Joe. Thank you.
Should I respond just briefly?
Yeah, please respond. Please go ahead. Yeah.
No, I agree with you completely. So I'm not going to push back at all. The only thing I will say in the spirit of agreement is that we've had people commenting about politics, about the role of scientists and scientific expertise. And also, I think, Mary, you talked about, the people, the people's behavior. And the tragedy in the United States is all of those are connected, right? In other words, that the leadership has undermined the role of scientific expertise and has also undermined societal compliance with whether it be mask orders or other types of behavioral changes. So that those are not, random. It's not like that all Americans disrespect scientific expertise. It's that unfortunately, that whole arena has been politicized at obviously a very terrible time.
Professor Vogel, just a brief comment, because I think in the context of this, our UNESCO bioethics initiative, I think the ethical aspects become really important in terms of what can we do as scientists. So for example, and in this case, as clinicians, people, health professionals, and I look at Dr. Fauci in our country, and I look at Dr. Atlas, both scientists, both eminent physicians, one an infectious disease specialist, and another someone who's never had anything to do with infectious disease or no expertise there. But the importance of us being true to our own professions and we have certain expertise. Let's stick with our expertise. Let's not mouth off. We can have opinions, but let's not mouth off expert opinions as Dr. Atlas has been doing and spouting off in ways which are, quote, authoritative, but are really lacking in any scientific substance. And the point being, we as a profession, a healthcare profession, for example, have to be more mindful of our own professional responsibility. And we need to call a spade a spade. And even if we've got people acting in bad faith or outside their scope, if you will, in our own profession, we need to call them out. And organizations need to call them out. And we as professionals need to call them out. What Dr. Atlas has been doing, actually, quite candidly, he can have his opinion. And I think that's fair. All of us can have our opinion. But when you're in a position of authority, and not only are you in a position of authority, you're conveying, the stamp of this is what we know. This is what we should do based on what we know. And you are so uninformed. We as a profession need to call that out.
Yeah, Professor Rajiv, I think the term they're using is epistemic trespassing. Going out of your, expertise and talking about, something where you actually don't know much about.
Epistemic trespassing.
Yeah. Professor Stephen, you can respond to that.
I agree completely. No, we've got other commentators, but I agree absolutely. The tragedy in the United States case is that Dr. Atlas was sought out. I mean, it's not random. That's the opinion they wanted, and that's what they got. But it is tragic, and we have to push back.
Thank you, Professor Stephen. Vivian, would you like? We've kept you intentionally at the end, so that we can to get a law perspective properly. That'll be a good discussion. Can you unmute yourself? I've sent a request to unmute. Yeah.
Thank you. I did try. I'm sorry. Well, I'd like to thank Stephen Vogel. He gave such an interesting talk, and I'm very grateful for him putting those hypotheses out for us to consider, particularly here in the UK at the moment, where the position is extremely gloomy. And I would, if you bear with me, I would like to take up your three categories, if you like, that you identified when you first heard Professor Vogel speaking, of the political system, healthcare system, and people, because that does chime with me very much, I think. Although, of course, I'd like to reflect for much longer on these hypotheses, extremely interesting. But if you take our political system here in the UK, of course, we have a first past the post right-wing system at the moment, with a prime minister who is a populist leader, but the situation has been greatly exacerbated here because of devolution, and we find that there's a disconnect now between and a strained relationship between the government in Westminster and the devolved parts of the UK, that's Wales, Scotland and Northern Ireland. And the legislation relating to COVID is different now. Regulations made under the initial acts and under the Coronavirus Act, as well as the Public Health Acts, is now departing from the Westminster model to some extent, because health education, for example, are devolved, housing is devolved, and people in the devolved nations have rather different views. They wanted to act sooner. Our government in Wales, for example, did act sooner in the second wave, second surge. We are all worried about whether we'll have sufficient money allocated to us to cope with the economic position. It's a very, very difficult time here in the UK, particularly because we, about to leave the EU. It looks as though we're not going to have a deal. Huge worries here for the economy. So a lot of what appeared in these hypotheses was very, very relevant and very grateful. And I will be taking them back to our students. As to our healthcare system, yes, we do have a coherent universal health system here, but it's being delivered in different ways. And some clinicians, even living in England, don't even recognise the way in which we deliver healthcare in Wales, because we have different legal structure and a different healthcare system, as do Scotland and Northern Ireland. So there's a huge amount of disparity there. And in Wales, we have wanted to listen to our scientific advisors. We did participate in the COBRA meetings initially held in Westminster, but the other three, the devolved nations, were no longer invited to those after June. So we were sort of on our own, listening to our own chief medical officers, our own chief scientific advisors, and very, very anxious to create clarity, because there is no clarity now across the UK. Different parts, people living in different parts of the UK have no idea what the law is in other parts. So, for example, people from England have been forbidden to travel into Wales unless it's for essential services. I don't think there's anyone actually policing the border. We don't know, but there are stories about police being, on the Severn Bridge that drives people from England into Wales. So there are many, many things to think about here, and no time to go into them all, but I am going to really spend a lot of time considering these things. Finally, the political leadership. There are huge allegations of bureaucratic corruption at the moment. The political leaders seem unwilling to listen to the other political leaders of the devolved nations. Behavioral scientists warned in broader terms of people in the population, warned at the start of this that people would get tired or upset, as you mentioned, Professor Mary, worried about their relatives in care homes, for example. But also younger people would, they predicted, become absolutely fed up of having to stay in. Yeah. And we've seen very, very poor behavior on the part of some of the youngsters, which is completely understandable. So yes, people make a huge difference. And again, we must throw into this hugely complex situation ethics, the repercussions for the justice system. There is so much to talk about and so much to think about. So I'm very grateful. Thank you so much, Stephen.
Well, thank you for those very gracious comments. As predicted, I think I learned much more from my commentators than I think I offered all of you. But in your case, that was really interesting to me to hear about the devolution, because of course the United States has has struggled with a federal system, and we think of the UK, as a unitary system, that it should be easier. But when you have, but obviously as the United Kingdom with the different, areas, that's a struggle. I mean, in the United States, it's been a nightmare because there hasn't been federal leadership, and so each state has been trying to kind of manage, but maybe with kind of like with one arm tied behind their back, because there isn't the central coordination that you would really need for some aspects. I mean, you can deal with masks at the state level, but the supply chain really has to be national. So that's been a huge problem in the United States. So it's kind of interesting to hear the struggles that the UK has been having along those lines.
Thank you.
And sorry, I just wanted to refer people to the Oxford University Policy Tracker, which is tracking policy responses across the world, as I'm sure you will know. But I have found that very useful, and I will certainly add Stephen's comments as well now into that. Thank you.
Yeah, no, that's been neat. Yeah.
Professor Vogel, I mean, one of the things that I think, I'm sure John Meacham, as a political historian, as a historian, is someone you are fond of. I am very fond of him. And I think one of the things that he's reminded us is, the attributes of good leadership, three traits that he's identified as being essential, critical, looking at all our presidents, for example, are curiosity, humility, and empathy. Those are the three traits that he's identified. And my suggestion would be that we can start with ourselves. We ourselves individually, if we can try and embody them in our conversations about each other, with people we disagree with, and then build from there, I think they would do us a lot of good in terms of making sure that we are much better prepared for a future crisis.
In a nutshell, you mean do away with politicians?
So we will, Rajiv, so we will, besides empathy, we need to be curious too, is that right?
Curious and humble, humility. These are the three things, yes.
Yeah, but humility and empathy, we certainly.
But that actually is really a food for thought, because I was thinking of a woman when you said that. Those are the virtues of a woman, so you can connect that, you can connect that to why where there were countries with women leadership, they did well, probably.
But Rajiv gave
a man says that, but when a woman says that, these are virtues of a woman that men don't have, that almost sounds sexist, if you will. Would you not agree?
Yeah, but Professor Rajiv, it's also biblical. I just wanted you to know that. Okay.
But Mary, two things. One is Stephen showed that it didn't, the one they put about women leaders, that didn't really correlate. But what actually Ravi said was actually true, because both the German and the both followed science, and that certainly is different from, say, the leadership of the United States, where Fauci was not listened to. Here they took implicit, both of them have accepted. Is that right? So the women actually took the science and then they got the glory. You see?
They got that. That's very interesting. Maybe you should look into that, Professor Stephen.
I think it goes back
women leadership and COVID-19. You'd probably find a lot. Okay, so we will take a few questions, because I'm sure there are people who are interested. I think Kesa Barot had raised your hand raised. Did you want to say something, Kesa? Are you there? Okay, so you can just.
You are now, if you want, put your hand, open your
screen. You can open your
screen, and you have the panelists here. You have Stephen, and you can ask a question or make your comment.
Did Kesa? Can you write on the chat box? Yeah, did you have a question or did you just put up your hand to say hi?
I'll just unmute. You can.
Yeah,
Yes, please.
This program is very good.
Can you please tell us where you're speaking from? And yeah.
I'm from Mumbai.
Yes.
And I'm a past president of IMA Mumbai branch.
Yes, sir.
Past vice president of IMA Maharashtra State.
Yes.
I've been following this program and I really enjoyed it. And I thank you very much for giving me an opportunity to say something.
Thank you. Thank you very much, sir. Professor Ali from the Kurdish Republic of Iraq. Professor Ali, would you like to say something? I can send you I've sent you a request to unmute and to start your video, Professor Ali.
Yeah. Hello, everyone. It was very interesting to hear about the economic burdens of the COVID-19 on all over the world. Yeah.
Go ahead, sir. Okay, I think it's unmuted. Okay, muted. All right. Are there any questions for our panelists?
No, I don't see any questions as such, but if anyone has, you can raise your hand or even type it in the chat box as of now.
There was no chat box.
There is a chat box, sir. It's there in below.
You can ask your question, sir, please.
You can go ahead and ask your question too. Okay.
I just wanted to thank everybody for giving such a nice, you especially and Dr. Russell, very much for giving such a good web discussion.
Thank you, sir.
Thank you. Thank you, sir.
All right. So
I thought that what Dr. Geeta was making, did some comments. Dr. Geeta Lakshmi, if you're still there, do you want to make talk here? You've written about India, the scenario is different. And of course, we have Ravi and others here. Is Dr. Geeta Lakshmi there?
She was.
She was.
But Dr. Ravi Wankhedkar, also our past national president, gave a very good view about this. I would thank him also.
Yes,
thank you, sir. Thank you.
Dr. Geeta is offline.
Okay. Would Des do you want to say something, Des Kahil? So would you like? No? Okay, he has put a comment there. Professor Stephen, you can probably read it. I think it is. It's meant for you. Okay.
Oh, Jacinda Arden does not have a scientific background, but has a bachelor in communication studies.
Okay.
That's right. Yeah. She has, she graduated in the year 2000 or 2001 in communication studies, specializing in, certainly in politics, and then began working in, I think, the Prime Minister's office very early on. So there's nothing healthcare or healthcare in her background or a strict scientific background.
But no, the thing is that she accepted, she followed scientific advice.
She did. Yes. No,
yeah,
that's very clear. Yeah, she did.
And that's as a leader, I think both. And Angela Merkel also said she followed the took the exclusive, she took her decisions based on the scientific advice.
So I think we have also exceeded. We have gone for nearly 3 hours. I'm sure none of the panelists noticed that. Professor Steve, a very interesting discussion. We'd love to have a different viewpoint, because as doctors and as we have different perspective. We are, we look at it in a different way. It's good that we can have someone like you to come and tell us to, who can extend and open our, increase the breadth of our knowledge. We thank you very much. Very interesting hypothesis. I hope we will get to see more of, that you'll be writing more about it. And of course, Professor Rajiv Tandon will be monitoring you, so you have to be careful.
Okay, good.
But I'd like to
I learned a lot from you, and the comments and questions were just fabulous. So thank you so much.
Thank you, Stephen. Thank you. Thank you to all our panelists. Thank you for getting up early in the morning. And Professor Joe and Professor Shabir, please go back to sleep. Good night.
What about Rajiv?
Rajiv, dear. Professor Rajiv, yes, please. Thank you very much. Very kind that you could join, and Professor Ravi. And but I'd like to end with what Dr. Shabir has written. He's written, "Women listen." So I stop. That is period. Okay, thank you very much. Professor Russell, it's over to you.
Thank you, Mary. Thank you very much, and Derek. And certainly thank you, Stephen. You've given us food for thought. And I think what you've seen from our panelists here, they were able to tease out some very interesting comments, which I think will aid in bringing this aspect to the political economist, as you were saying. One important thing that Shabir talked about: how do you measure suffering? How is suffering? We are in the business of suffering. That's the business. We are in the business of suffering, identifying, acknowledging, and having the authentic desire to relieve suffering. That's what we're all here for. And
as health professionals.
Yes, we identify, we see suffering, we identify suffering, and we want to have the authentic desire to relieve suffering. And then comes all these other things that we're doing. So Shabir's word was on, do we have a way of economists and political economists bringing in a value or putting some on the intangible aspect of suffering? One, I think that's it was quite a good because when we look at it, I think that's something that I was thinking too. We are attuned to that. And of course, this has, so it's a thought, and I think we are marrying political economy, and you're talking of health care, and then of course Vivian brings the legal part of that from her domain, and I think that's the great yeah. And again, this is another demonstration of our solidarity in all of us coming together to deal with this. And I keep bringing this back because solidarity and cooperation is demonstrated here, and it is Article 13 of the Universal Declaration on Ethics, Bioethics, and Human Rights. So this is excellent. And I just thought I should, Rajiv, one of the final synthesis that Steve from his data came out with: political systems matter, but only in combination with other factors such as individual leadership, policy expertise, and importantly, execution may not be important, may be more important than what he brought out was political regime type.
That's true.
Right? That I think brings some, so I think I want now to thank all of you. And I think one of the take home I want to take back from here is wonderful what we did. One important thing is we must keep in mind suffering. And the other important issue here is that we take home curiosity, right? Empathy
and humility.
And humility, right? So if we could do this together with our solidarity, then today is a great success for all of us, and indeed for the world that we live in. Thank you very much, all my distinguished panelists, our presenter, particularly the panelists who came out at 2 in the morning, which shows not only their grit, but their solidarity and the value they give to the importance of ethics in all this. And as Rajiv said, at the UNESCO chair in bioethics has brought all this great, wonderful people from around the world. As you may see, we sit here from the top of this globe. I'm under the globe. We all are in the middle, all over the place. And we had Alvin in his daughter's marriage joining us with his from the marriage, showing how important he feels and how to this very important topic and the series that we brought together, and all of them, Rajiv, Shabir, Ravi, Alvin, Joe, and Vivian, have all come many times to bring this important aspect. So, and also your good cousin Harold has also been on this with us. Yeah. So
Thank you very much.
I want to also acknowledge Professor Amnon Kami.
Thank you.
Yes, Amnon, thank you very much.
He sat through it.
He sat through, and I know he will send me a note always very quickly commenting and supporting what we're doing. So wonderful to see this. Thank you all very much. Thank you, Professor Amnon. And I want to again thank and welcome our new group, from the Kurdish region of Iraq, the Hawla Medical Unit. We have the Dean and Secretary, both the head and Secretary of the unit, who have also been very actively with us all the time. So thank you very much for that. So till we meet again, we'll stay safe and we stay well. Thank you very much, all of you.
Thank you.
Thank
Professor
you.
Stephen.
Thank you.
Professor Stephen, our love to Harold.
Oh, yes, I will send him my best, your best.
Yeah, thank you.
Yes.
Thank you, Professor Kami. Thank you to all. Thank you, Professor.
Thank you, everyone.
All the best. Bye.
Rajiv, Joe, and Sabir, go back to sleep.
They've already gone. They've gone.
Let's see. You finish now. Huh? You want me to drive, you can talk to her.